Hey everyone, welcome back to Med-Surg Mentor. Today let's review the topic cardiac tamponade. So let's begin. Now let's see what is cardiac tamponade. Cardiac tamponade is the accumulation of excess fluid within the pericardial space, resulting in impaired cardiac filling, reduction in stroke volume, and epicardial coronary artery compression with resultant myocardial ischemia. Common etiologies of cardiac tamponade are myocardial infarction, connective tissue disorders, ruptured aortic aneurysm, autoimmune diseases like lupus, complications of cardiac surgery, hypothyroidism, pericarditis, cancer, kidney failure, chest trauma, and gunshot or stab wounds. Pathophysiology of cardiac tamponade. Due to etiologies, fluid accumulates within the pericardium, which exerts excess pressure on heart. Gradually, it compresses the cardiac chambers and impairs diastolic filling. Thus, less blood leaves the heart for systemic circulation. As a result of this, the stroke volume and cardiac output are reduced, resulting in hypotension and shock. At the same time, the venous pressure is increased due to the compression of ventricles. It results in systemic congestion and pulmonary congestion. Common systemic congestion manifestations are jugular venous distension, ascites, hepatomegaly, and peripheral edema. Similarly, pulmonary congestion is manifested as shortness of breath and other respiratory symptoms. Common clinical features of cardiac tamponade are chest discomfort, shortness of breath, lightheadedness, cough, weakness, peripheral edema, tachycardia, anxiety, restlessness, hypotension, chest pain radiating to neck, shoulders or back, rapid breathing, and neck vein enlargement. Now let's move on to the diagnostic measures of cardiac tamponade. First of all, let's see the physical examination findings. And the first one is Beck's triad. It includes low blood pressure, jugular venous distension, and muffled heart sounds. In combination, these three classical signs are called Beck's triad. Second physical examination finding is pulsus paradoxus. It means there's a drop of at least 10 millimeters of mercury in arterial blood pressure with inspiration. And the third diagnostic measure is ST segment changes in the electrocardiogram. Other common diagnostic measures of cardiac tamponade are echocardiogram, electrocardiogram, chest X-ray, thoracic CT, and magnetic resonance angiogram. Next is management of cardiac tamponade. Common medical managements are antibiotic therapy for bacterial infection, fluid therapy to increase the blood pressure, pain medicine such as aspirin, anti-inflammatory medicine such as steroids or colchicine, oxygen therapy to reduce myocardial workload, and inotropes like dobutamine to increase cardiac contractility. Invasive procedures done to treat cardiac tamponade are pericardiocentesis, pericardiectomy, and thoracotomy. Pericardioccentesis is the removal of the fluid from the pericardium using a needle. Similarly, pericardiectomy is a surgical removal of a part of the pericardium to relieve pressure on the heart. Third procedure is thoracotomy, It is the surgical procedure done through the incision that is made through the chest wall, which allows the drainage of blood or blood clots around the heart. Some of the common nursing diagnoses for patients with cardiac tamponade are decreased cardiac output related to reduced ventricular filling secondary to increased intrapericardial pressure, impaired gas exchange related to ventilation perfusion mismatch, acute pain related to inflammation of the pericardium, ineffective breathing pattern related to hyperventilation, activity intolerance related to fatigue, anxiety related to disease process, and knowledge deficit regarding disease condition. Nursing care of patient with cardiac tamponade. Common nursing cares are continuously monitor ECG for arrhythmias, monitor blood pressure, heart rate and urine output, provide supplemental oxygen as ordered, initiate 2 large bore intravenous lines for fluid administration, administer dobutamine to enhance myocardial contractility, assess neurological status, and prepare patient for surgical procedures. With this, we are finishing the topic cardiac tamponade. We have seen the definition, etiology, pathophysiology, clinical features, diagnostic measures, management, and nursing care. Cardiac tamponade is the accumulation of excess fluid within the pericardial sac, which gradually impairs the cardiac function. Common physical examination findings are Beck's triad and pulsus paradoxus. Pericardiocentesis is the major invasive procedure done to treat cardiac tamponade. Thank you so much for watching. See you next week with a different interesting topic. If you find this video helpful, please like, share and subscribe.